Professionals who secure the health, well-being, and just treatment of Maryland citizens. We create the knowledge that cures disease and strengthens communities across the state and around the world. UMB makes the world more just, more enlightened, healthier, and more humane. We are UMB.
State Circle is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
A budget buster or a roadmap to having the nation's best schools.
So we not only have to get to where we were last year, we've got to make up last year in terms of learning loss.
The Senate president wants to hit these big out-of-state companies, but he's swinging and missing and hitting his own constituents.
The long wait at the unemployment line.
A simple, how long is it going to take? Their responses, I don't know. Well, what do you know?
And the COVID vaccine in short supply.
We need more damn vaccines.
Connecting Marylanders to their government. This is State Circle.
Good evening. The big story around State Circle this week is a final passing grade for the Kirwan Education Plan. The state Senate today completed the process of overriding Governor Hogan's vetoes on both the bill and a related tax package, as Charles Robinson reports.
Today I rise on behalf of the 900,000 public school students, the 70,000 public teachers and administrators, and millions of parents across Maryland to plead with my House colleagues on both sides of the aisle to override the governor's veto of the Blueprint for Maryland's Future.
The Blueprint for Maryland's Future, commonly referred to as the Kirwan Plan, would inject an estimated $2.6 billion in funding for schools per year.
I hope with all hope that you are right. I hope that this works. I hope that all this money makes a difference.
The price tag on the blueprint is one thing, but the way it's paid for makes the governor's supporters cringe.
Our goal is simple. This is to sustain Governor Hogan's veto of House Bill 732, the $250 million digital ad tax. Our main point is this. Thousands of Maryland businesses, small businesses have closed and aren't going to reopen. And for those who do survive, the last thing they need is another tax.
We can afford it. We have the money right here in the Blueprint Fund. It's there. It's right in there. Page 11 of the fiscal note. I have it.
The clerk will take the call. There being 95 votes in the affirmative, the veto is overridden.
So now that the House has finished its deliberations, it's the Senate's turn, and it will be some of the same arguments.
We think it's a great investment. We think it's going to be done thoughtfully with accountability. So unfortunately, we were excited going into last year, and then the governor vetoed it and actually set back this plan a year. And now we have COVID, where a lot of students have gotten crushed. So we not only have to get to where we were last year, we've got to make up the last year in terms of learning loss.
The Senate president wants to hit these big out-of-state companies, but he's swinging and missing and hitting his own constituents with this tax.
Maryland may be the first of many states who are considering this as a way to fund schools in an era of COVID-19 with dwindling resources. In Annapolis, I'm Charles Robinson for State Circle.
Legislative leaders say that Maryland's unemployment system is broken. Our Sue Copen says they are proposing an overhaul of the system to make sure it works for the next recession.
Maryland unemployment insurance is a joke. It's not insurance. It's a nightmare.
Lisa Anderson is a single mom with two daughters, one a high school senior, the other in college. She worked in the billing office of shock trauma. Then the pandemic hit.
We got let go on March 13th at 3:31 p.m. I'll never forget that day for as long as I live.
Anderson filed immediately for unemployment insurance. Her online application got lost. Emails and calls went unanswered. Benefits would start, then stop. The battle continues.
A simple, how long is it going to take? Their responses, I don't know. Well, what do you know? I can't tell the mortgage company, I don't know. I can't tell BG&E, I don't know. I can't tell my kids when they're hungry, I don't know.
This unemployment insurance program is supposed to help Marylanders at a low point when they've lost a job. It's failed.
State lawmakers say they've heard from thousands of residents seeking help with getting their benefits. Delegate Ned Carey says the state just wasn't prepared to tackle a crisis like the pandemic.
There was not a plan in place to ramp up services and infrastructure to deal with the increased claims and the phone call volumes that we've experienced.
So Democratic leaders of the House and Senate are proposing a package of reforms to create a better system.
Our legislation will, number one, substantially increase the income disregard so Marylanders can earn some amount of money while still claiming unemployment. This is a necessary change in the new gig economy.
Also included in the plan, increasing maximum weekly benefits, expanding eligibility, ensuring staffing needs are met, and allowing for direct deposits and paper checks.
The challenge is not the individuals who are doing this work. The challenge is the system.
But the governor sees it differently. A spokesman issued a written statement saying Maryland has one of the strongest unemployment systems in the country, consistently resolving more than 95% of claims throughout the pandemic and aggressively blocking fraud at every turn. What is being proposed today is a Band-Aid and not even close to a real and permanent fix. But for Lisa Anderson and her family, who are also dealing with both physical and mental health challenges as well, change is needed, even as Anderson looks to the future.
I've acquired 3 different certifications. I'm working on my last one, which I should be done by the end of April. And then hopefully I can get the vaccine and I can get back out and working and I won't need unemployment ever again.
Sue Copen for State Circle.
As lawmakers consider a number of proposals to reform policing, they are also examining an artifact of the Civil War era. The Baltimore Police Force is actually an agency of state government. The Senate Judicial Proceedings Committee heard testimony on a proposal to restore full control to city government.
There was a few years ago where the city council wanted to mandate body cams for all of the Baltimore City Police Department. And it was at that point that the city law department informed the council that they were not able to do that as a result of not having local control. Additionally, there was an overtime fraud situation occurring in Baltimore City for the last few years. And it wasn't until very recently that changed as a result of public pressure. But indeed, had the city council had local control, they would have been able to make that change as well.
While the Baltimore Police Force is technically not a city agency, the mayor does choose the police commissioner. Virtual committee hearings like that one are now live streamed for all to see. The flip side is that some advocates feel left out of the process. Nancy Yamada reports.
The feeling is so different to be here rather than there in Annapolis.
Vinnie DeMarco, president of Maryland Citizens Health Initiative, a nonprofit which advocates for public health, says this session is unlike any other. This week, he learned about an important veto override of a prescription drug affordability board funding bill from his home. In years past,
I would have been in the gallery watching. And after that, I would have gone to talk to Nancy and all the other reporters about it and congratulated the legislators. Instead, I'm on my basement, found out by Zoom and had to send out everything by email.
Lobbyists aren't the only ones who are trying to influence lawmakers without face-to-face meetings.
If you rally on Zoom, does anyone hear it?
Rebecca Snyder is the executive director of the Maryland-Delaware D.C. Press Association. She's among the people and organizations who are concerned that pandemic protocols are limiting testimony at hearings. In the Senate, some committee testimony is capped at 4 opponents and 4 proponents, 3 of whom are chosen by the bill's sponsor.
I'm not casting aspersions on any of the committee chairs, but I think it creates an appearance of picking winners and losers that just is not appropriate. We want to engage with as many people in as many different perspectives as we can, because that's what creates stronger legislation.
We simply can't have like 20 people or 30 people
per bill when you have 7 or 8 bills during a day.
While the chair of the Environment and Transportation Committee agrees there are drawbacks to virtual hearings,
I don't have the ability to judge the body language and the emotional reaction to testimony of my committee.
Delegate Kumar Barve says there are also benefits and in some ways more access for those who want to testify.
In prior years, people would have to take a day off from work and drive over the bridge in bad weather and sit in a committee for 2 or 3 hours to testify. And now, because of Zoom, at least the positive thing for these people who are driving from the Eastern Shore or Western Maryland, they're able to do it from their office or their home and they don't have to get on the road.
Everyone I spoke with agrees that post-pandemic, the legislature might want to consider keeping some of the procedural changes that have made life easier, but nothing will beat face-to-face interaction.
A hugger. I'm a person who likes to celebrate and see people in the flesh and just find that person and talk with them and look them in the eye and say, how can we work this out?
For DeMarco and everyone, the end of the pandemic can't come soon enough. I'm Nancy Amata for State Circle.
Governor Hogan was at the White House today, part of a group of governors and mayors meeting with President Biden on accelerating the rollout of vaccines for COVID-19. Yesterday, the governor said the conditions have improved enough for hospitals and nursing homes to begin allowing visitors. Facing criticism from Democrats in Annapolis and Washington on the speed of Maryland's vaccine program, the governor said the state is using every dose it gets from the federal government.
The basic problem is pretty simple. We need more damn vaccines. If I needed to drain the entire rainy day fund to buy enough vaccines for every eligible Marylander, I would do so today. Unfortunately, we have no control whatsoever over this supply problem.
The state's vaccine website is covidvax.maryland.gov. The governor said a new call center will open next week. Our newsmaker this week is Ed Singer. He is the Carroll County Health Officer, also the president of the Maryland Association of County Health Officers. Mr. Singer, thank you for being with us again. Let me start with a blue sky question. How is the vaccination campaign going from your perspective and the perspective of your fellow health officers?
I think from our perspective, the local health departments have done this before with H1N1 and other mass vaccination efforts, with even with flu clinics and things of that nature. So we're experienced in doing this. We've really ramped up our operations and we're prepared to vaccinate a lot of people. I know, talking to some of my fellow health officers, they feel like they can get as many as 1,000 people an hour through some of our local health department vaccination clinics. We're just obviously, as the governor said in some of his press conferences, there's just not enough vaccine available. So we're essentially, the old saying, how do you eat an elephant? One bite at a time. We've got a large group of people that we need to get vaccinated. A lot of them some of them still in 1A, some of them still in 1B. And there are a lot of them that we still haven't reached. And I know the local health departments are methodically working through those groups, trying to figure out how to reach the most hard to reach people and trying to get our most vulnerable populations vaccinated. And we're making progress on that, but the limiting factor has been the amount of vaccine that we're receiving.
What are the points of friction between the counties and the state health department? We know there were some letters that went back and forth this week.
Right. And I actually just got done listening to the governor's press conference today. It's February the 11th. He just spoke, I think, at 2:00, and he kind of essentially reflected that the local health departments wanted a monopoly on the vaccine. And I guess our perspective is that we want to reach that most vulnerable population. The state's expanded to 1C. They're doing mass vaccination clinics, but a lot of the people that we're trying to reach who are over 75 and are economically disadvantaged don't have computer access. They don't have email accounts, and they're not going to be able to register for a mass vaccination clinic, or they're not going to be able to register for a vaccination clinic at Giant or Walmart, or maybe they can't even get out of their house. So it's our job as local health to prioritize those people and to help make sure that they get vaccinated. And I guess as we spread this vaccine out to mass vaccination clinics and to commercial pharmacies, it's made less available to the local health department. So it's not that we really want a monopoly on the vaccine, as the governor has implied. It's that we really want to be able to reach these vulnerable populations. And I still have thousands of people who are over 75 in my county that are yet to be vaccinated. And as we're, the private pharmacies are going to take anybody who's in the group that the state's opened it up to. I just don't think that it's the right thing for us to be doing as public health professionals to reach to those groups that are in 1C before we get done with the people who are in 1B. Because if you look at the statistics, it's very obvious that a lot of the people who are dying from this are being hospitalized or over the age of 75. And we really want to be able to reach that population. And at the rate we're moving right now with the local health departments, it's going to take us, most of us, at least another month or so to get through that population with the amount of vaccine that we're getting.
To your point, I received an email from a viewer with a similar question, and she wanted to know, said that vaccine eligibility has been open to people over 65, yet Anne Arundel County, where she lives, the county website and numerous pharmacies insist that people 65 and up are not eligible at this time. Why is Maryland making it harder for seniors to be protected?
Well, I don't think that it's Maryland that's making it harder for seniors to be protected. It's that we realize that the people who are over 75 are more vulnerable than the people who are in that age group 65 to 74. If you look at the number of people who are hospitalized and the number of people who are dying, it's people who are over 75 are much more vulnerable. The governor and the Department of Health have given us the local flexibility as local health departments and other local agencies and providers to decide if we want to vaccinate people in priority group 1C, or if we want to stick to 1B and try to hit those. There's a reason that people were prioritized in category 1A, 1B, and 1C, and it all has to do with levels of risk. And while it's very important that we want to vaccinate the people in 1C as well, the people who are in priority 1B are much more at risk, and we really feel like we need to reach them first. And that's the reason that those categories were set out that way.
All right. So, Ed, if somebody lives in Westminster and let's say they're 70 years old, maybe they have a health condition, maybe they don't, they're confused at this point. Do they go to you? Do they go to the drugstore, the grocery store, the local hospital? What are they supposed to do?
So I can tell you, I've been coordinating very closely with our local hospital, and the local hospital and the health department are essentially on the same page. We're trying to stick to the people who are in that 1A and 1B category right now. So if you're in 1C, while the state's opened it up to that, really, I think the only place that you're going to be able to get vaccinated if you're in 1C is if you go to one of the mass vaccination clinics, or if you sign up with one of the pharmacies that are willing to let you sign up. I just think we have a duty as public health to ensure that the most vulnerable people are vaccinated and prioritized first.
You know, the big picture here, and obviously there's a little bit of sand in the gears at this point. But if you look out a couple of months, it's going to be springtime. Next week, I think we're going to hit the 1 million mark in Maryland for the number of vaccines administered. State of 6 million people. Not hard to see that when we get into April, hopefully maybe a third or more of people in the state, hopefully all the high risk people are going to have their shots. And this whole situation is going to look a lot different. Am I being too optimistic here?
Well, I hope you're correct. I mean, first of all, it's going to be dependent upon more vaccine being able to be produced, and potentially more vaccine companies being able to provide vaccine. I know the governor referred today in his press conference that he's encouraged the president to invoke the Defense Production Act. You know, if we could get more vaccine, we could obviously vaccinate more people. We definitely locally have the capability to vaccinate a lot of people. And, you know, as we get into phase 2 and phase 3, which are still a little ways off, we're going to need the support of all the care providers, the pharmacies and commercial providers and whatnot to get everybody vaccinated. We really, you know, there's no way that the local health departments think we can do this all on our own to vaccinate the entire population of our county, and we don't want to do that. We're just concerned right now with the limited supply of vaccine that's available, trying to be able to reach those most vulnerable populations until the vaccine supply becomes less of an issue.
What's happening in your county in terms of the spread of the pandemic, number of people in the hospital, the ability of schools and restaurants and other businesses to open up?
Well, things have loosened up a little bit. We hit a huge spike over the holidays because of travel and things of that nature. Our hospital was stretched to its limits, and they were having people backed up in the emergency department waiting for beds and things like that. We're still at a fairly high number of cases. They're in the mid-20s, which is where we were at the beginning of this pandemic as far as number of people that they're treating for COVID in their hospital on a daily basis. So the hospital's still stretched, but it's better than it was in late December. The trend is in the right direction. The governor talked about this today, how we're kind of in a better place from positivity rate and cases per 100,000 than we were on November 8th. But November 8th is when we really started to hit that spike. So, I'd really like to see us getting down to where we were, make us feel a little more comfortable where we were over the summer, where we were seeing a lot fewer cases. I mean, we're still seeing an average of over 30 cases a day in Carroll County. It's probably around 35 cases per day that we're seeing on a regular basis. We were hoping before school started back in, before school season started back in September, that we would get down under 5 cases per day in the county. So, I think we've got a long ways to go in this pandemic. We need to continue to focus on trying to limit the spread of the disease, but we're getting people vaccinated. We're making progress. It's good to see the trend moving in a good direction. And as spring comes and we're able to get outdoors more and we have less indoor interaction, I think that'll help to bring the numbers down as well. So it's going to be a lot of things that we're working on, getting people vaccinated.
Our thanks to Ed Singer, president of the Maryland Association of County Health Officers. Joining us for the political roundtable this week, reporter Rachel Bay of WYPR Radio and, of course, MPT's Charles Robinson. Thanks for being here. You both watched the Senate of Maryland debating the veto overrides today of the Kerwin education plan and a digital advertising tax. What were your takeaways from that?
I'll go first. And part of it is this idea that the Kerwin portion, which is this huge funding mechanism for schools measuring in the billions of dollars. A lot of people didn't like the price tag. Let's begin with that. And because they did not like the price tag, they wanted to, let's throw it away and start over again. The Democrats who were for this argued that we had to wait a whole year because of this veto by the governor, and we were going to put people behind educationally. And that became this rallying cry. We need to go on and implement Kerwin, which is the blueprint for the future.
And now that the way a veto override works is the bill takes effect in 30 days, correct, Rachel?
That is correct.
Yep, that's right. Yep, that's right. And this was kind of the governor vetoed 37 bills last spring. So there's been a marathon of veto overrides in both the House and the Senate over the last couple of weeks, really. And the other bill you mentioned that they voted to override today was the digital ad tax. It increases the tobacco tax and also imposes a new tax on digital advertising. And the way this works is it applies to companies that take in at least $100 million in worldwide revenue in a year. So these are big companies. And Republicans have argued that the companies, which the examples that are typically given are Google and Facebook, will pass this tax down to the small Maryland businesses that are placing ads on Google and Facebook. But there is also a bill currently in the legislature that this year that aims to kind of prevent that from happening. But this is the first time that any state has done anything like this, and Republicans have also argued that this might not pass constitutional muster, that it's going to be challenged in court, and that Maryland is not going to see a dime of that revenue.
The number of votes necessary in the Senate to override a gubernatorial veto was 29. Kerwin, there were 31 in favor of overriding the veto. The tax bill was 29. Rachel, there's a separate tax bill that sounds similar, right?
That's right. There's another bill that was also vetoed last year that is a tax on digital products. So this is streaming services like Netflix and Spotify. This is also ebooks and digital greeting cards are also part of this. Funding for this is dedicated completely to Kerwin.
Charles, we want to update everybody briefly on the HBCU funding bill.
So first off, you got to remind yourself that Governor Hogan actually vetoed the original bill. There was a decision made by the leadership in both the House and the Senate to not bring that bill back because it had too many triggers. So they have put information in a new bill. It's HB1 and SB1, which will bring the money forward again, but this time will not have as many triggers as it had in the previous bill.
Our thanks to Charles Robinson, Rachel Bay. You can listen to Rachel's reports at wypr.org. Thanks, both of you. Have a good weekend.
You too.
You too.
Monday on Direct Connection, overcoming fears about the COVID-19 vaccines. That's live with your calls Monday evening at 7. Remember to follow us on Twitter and Facebook at MPT News. And now for all of us on the State Circle team, I'm Jeff Salkin. Thanks for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.
We at Sage Policy Group recognize that this is a challenging period for households and businesses. But Marylanders are intelligent, strong, inventive, and entrepreneurial. Eventually, this economy will bounce back stronger than ever.
Make inroads into the education field or advance your current teaching career through UMBC's professional master's programs and certificates.